Hello, my name is Fiona Campbell and I'm a senior lecturer in evidence synthesis based at Newcastle University in the UK, and I'm also an editor for the Children and Young People's Wellbeing Group within the Campbell collaboration. So the first question that I want to address is, how can we use evidence-based approaches to tackle multiple global health challenges? And I think one of the first things we have to do is start asking questions. We have to start asking questions of existing practices. Are the way that we've always been doing things the best way to be doing things? Are there any harmful effects of the way that we're doing things? Are there new ways of doing things? And I think sometimes those asking questions might seem harder than we realise. But I think if we're going to use evidence-based approaches, we have to be open to the idea of existing practices being challenged. And we have to look honestly, not only from our own experience, but we have to look at the research evidence and be prepared to change practice. One of the reasons that I trained in evidence synthesis methodology, got interested in research and developed skills in research was because I felt at times that some of the things that I saw happening in clinical practice, not only did they not work very well, but sometimes they were positively harmful. And I felt that using research evidence, and particularly evidence synthesis, could be a powerful way of leveraging change. But we can't change anything if people aren't prepared to ask questions and think and reflect on the practices that they currently use. Why is it important for different sectors to work together? Well, I know both from clinical practice and from research that sometimes we might try and address the immediate problem. For example, we might be trying to provide care for a child suffering from malnutrition, or to a child who's suffering the mental impact of experiencing trauma. But if we never do anything about the things that mean that child and the family possibly experience traumatic episodes or experience malnutrition, then actually we might be treating the very end of the symptom, but never actually addressing the underpinning causes. And if we're really going to tackle many of those global health challenges, we have to be getting to those root causes, and that means that we have to be working across sectors, because the thing that means that a child ends up in malnutrition isn't a health problem, that's a social problem. It impacts on their health, their growth, it impacts on their education, it impacts upon their ability to support their family, earn an income later in life. So actually we have to address some of those big challenges by working together. And I think one of the things that greatly helps that working together is communication, speaking to people. And in that we have to be so careful about our language, because even a phrase like evidence-based approaches might just not mean anything to people in other sectors, and they likewise will have language that they use. They all know what they mean, but actually when you get together, so it's always being really careful about the language you use, being prepared for people to say, and being prepared to say yourself, I don't understand what that means, can you explain it to me? And to become adept at being able to explain what you mean in language that's very, very accessible. So I think that ability to speak with people, talk to people, communicate, find all kinds of ways of communicating, but in language that's really accessible for everybody. And finally, how do we foster that culture of co-production? Somebody once said to me when I was talking to them about what good and effective partnership looks like, and they said effective partnership is when you know that together you're better than you can be on your own, that it isn't that one group brings something to the other, but actually that power is equally distributed. Everybody has something to bring, and that actually if we work together we can produce something that's so much more effective than if we try to work on our own, or if we believe that we've got the answers and other people don't. There is so much that we can learn from each other, so that willingness to listen, that willingness to learn, that openness, and that ability to reflect and answer questions. These are key foundational parts, components of effectively using evidence to challenge global health problems.